Hello and welcome to the Pharmacist's Patient Care Process training video. The Pharmacist's Patient Care Process, or PPCP, was released by the Joint Commission of Pharmacy Practitioners in order to meet the need for a consistent process in the delivery of patient care across the profession of pharmacy. As pharmacists directly engaged in the education and training of future pharmacists, it is important we adopt the PPCP within our practice sites and in our day-to-day modeling with pharmacy students. With the PPCP, pharmacists use a patient-centered approach in collaboration with other providers on the healthcare team to optimize patient health and medication outcomes. An essential first step is the establishment of a patient-pharmacist relationship that promotes effective communication between patients, families, and caregivers. Additionally, at the core of the process, pharmacists continually collaborate, document, and communicate with physicians, other pharmacists, and healthcare professionals in the provision of safe, effective, and coordinated care. In order to use principles of evidence-based practice, pharmacists must: Step 1. Collect. The pharmacist assures the collection of the necessary subjective and objective information about the patient in order to understand the relevant medical and medication history, as well as the clinical status of the patient. Step 2. Assess. The pharmacist assesses the information collected and analyzes the clinical effects of the patient's therapy in the context of the patient's overall health goals in order to identify and prioritize problems and achieve optimal care. Step 3. Plan. The pharmacist develops an individualized patient-centered care plan in collaboration with other healthcare professionals and the patient or caregiver that is both evidence-based and cost-effective. Step 4. Implement. The pharmacist implements the care plan in collaboration with other healthcare professionals and the patient or caregiver. Step 5. Follow-up. Monitor and evaluate. The pharmacist monitors and evaluates the effectiveness of the care plan and modifies the plan in collaboration with other healthcare professionals and the patient or caregiver as needed. The following video depicts how the PPCP can be used while training pharmacy students in both a community and an inpatient practice site. The first half of this video will be following a pharmacy student who is on an advanced community APPE at a local community pharmacy. The first scenario will demonstrate ineffective use of the PPCP by the student and the preceptor, leading to poor patient care. It will be followed by the second act, demonstrating appropriate use of the PPCP, leading to improved patient outcomes.
Our first CMR patient of the day is here. You feel ready?
About as ready as I'm going to be. Mr. Ross, are you ready? Let's go. So, Mr. Ross, is this your first CMR?
Yes, but I'm not really sure what a CMR is, but my insurance wanted me to have one.
Do you have any questions about your medications? Are they causing you any problems? Has anything changed?
I can't really think of anything.
Okay, well, don't forget to contact your doctor whenever you need a refill. And do you have any other questions for me?
No, thank you.
Okay.
Hey, Kate, so how'd it go?
Good, I think. He didn't have any questions, and I told him to follow up with his doctor, so I guess we'll see him next time.
Okay. Kate, looks like our first CMR patient of the day is here. Have you reviewed Mr. Ross's current medication list?
Yes, I have.
Okay. Alright, so this looks great. Just don't forget to ask about any over-the-counter medications or any other drugs that he's taking. Remember to ask questions to collect any other relevant information during his visit. And then after you identify any potential problems, you can work with Mr. Ross to come up with a plan suited for him. And if you need any help, I'll be here to assist you.
Okay, thanks. I won't forget anything. Mr. Ross, are you ready? Hi, Mr. Ross. My name is Kate, and I am a student pharmacist, and I will be conducting your visit today. So is this your first time having a CMR?
Yes, but I'm not really sure what a CMR is, just that my insurance company wanted me to have one.
Yes, they do want that because a CMR is a comprehensive medication review. Not only that, it gives us the opportunity to make sure that your medications are appropriate, safe, and effective. We can also discuss any side effects that you're having, as well as a chance for you to ask questions for me. So are you ready to get started?
Yes, I am.
Okay. So I see that you're taking a new medication called lisinopril. So tell me, how are you taking this medication?
My doctor told me to take it every morning, and I've been taking it just before breakfast.
That's right. So how are you feeling while taking the medication? Has your blood pressure been well controlled?
My doctor told me my blood pressure is doing well, and I actually feel pretty good.
Well, I've noticed that you've been coughing, and I also see your cough drops. How long has this cough been going on?
Now that I think about it, it started about the time I started this new medication.
Well, actually, a dry, persistent cough is a side effect of your medication lisinopril. And unfortunately, it's unlikely for the cough to resolve on its own, especially with cough drops. So what most people do when they're experiencing this side effect is to get switched over to a new medication. If you like, I'll be happy to call your doctor and recommend a different medication that can still control your blood pressure without the coughing.
Thank you so much. I had no idea that the medication could actually make me cough. So go ahead and contact my doctor.
No problem, anytime, and I will call your doctor as soon as we're done here. Also, I will follow up when I get that prescription for when you have your new medication. Now let's go ahead and continue discussing the medications you have for today.
Okay.
All right, I'll be sure to follow up with you on the new medication.
I'll get in contact with you as soon as I hear from you, and thanks again.
No problem.
All right, Kate, so how'd it go?
It was great. We identified a medication side effect that he was having with his lisinopril, and so I recommended calling his doctor to see if we can switch him to a different medication, such as an oral like losartan. So here are my notes, just to see what we went over.
All right, Kate, this looks great. I agree with your recommendation. Great job on creating a plan that Mr. Ross was eager to implement. Just remember to follow up with Mr. Ross after you speak with his physician and get a prescription for the losartan. Meanwhile, your next patient is here. Hi.
Now that you have seen an example of how to incorporate proper use of the PPCP in a community pharmacy, next we will show how the PPCP can result in improved patient outcomes in an inpatient setting. In this video, we will be following a pharmacy student who is on an inpatient APPE at a local hospital. The first scenario will demonstrate ineffective use of the PPCP by the student and the preceptor, leading to poor patient care. Next, we will observe a demonstration of appropriate use of the PPCP, leading to improved patient outcomes in an inpatient setting.
Good morning, Dr. Jones. I'm going to go up to the 8th floor for rounds if that's okay.
Good morning, Sam, and that's fine. Just let me know if you need anything.
Okay. Hi, I'm Sam. I'm the pharmacy student assigned to this floor today. So is this the rounding team?
Yes, I'm Dr. Scott. Today is the first day of my service on this floor. This is Nurse Baker, and she'll be taking over the first shift. We're about to have rounds with patient Miss Davis. Are you familiar with her?
Actually, no, I'm not. I haven't had the chance to review her since she was admitted.
Oh, okay. Well, Miss Davis is recovering from an acute GI bleed. She's been on warfarin for 3 years and has previously been quite stable. However, her INR was markedly elevated when she was admitted. Do we have any information about a sudden increase or what would cause a sudden increase in INR?
I spoke to her earlier and she mentioned that she had a UTI last week and she was recovering from that, but that shouldn't make her INR go up, should it?
Well, I guess the plan would be to go ahead and just monitor Ms. Davis daily. and we'll continue to adjust her warfarin dosage until our INR becomes therapeutic.
Sounds good. Thank you, doctor. Hey, Sam, how were rounds? Did you need any help with your patients?
No, I'm good. The physician didn't ask me any specific consults for today, so I don't know if they even need me for anything on follow-ups for the next patients.
Okay, well, that sounds good. Well, just let me know if you need anything. I'll check in on you later, okay?
Okay.
All right. Good morning, Sam. Have you reviewed your notes to get ready for rounds today?
Yes, I actually just got back from talking with one of my patients, Miss Davis. While I was reviewing her chart, I noticed that she was admitted for a GI bleed and is on warfarin therapy. Her INR at admissions was higher than her usual therapeutic level, so I decided to talk to her to see if there was anything about her medication regimen that had changed recently. And she told me she had a UTI last week while she was on vacation, and she was put on Bactrim.
Oh, good job collecting information from your patient. So, tell me, what do you think, how does this impact Mrs. Davis' INR?
Yeah, well, the Bactrim could increase the warfarin levels and increase the risk of having a GI bleed that she has.
That's right. That's absolutely right. So, tell me, what do you believe our next step should be?
Well, Miss Davis said she's finished the course of Bactrim and so she's no longer on it. So I feel that we could recommend to Dr. Scott that she could resume her normal dose of the warfarin since there's no longer that drug interaction. But I also plan to educate her on possible drug interactions with warfarin.
I agree, and that sounds great. Why don't you head up to rounds and let them know about your assessment and plan?
Yes, ma'am.
Okay.
Thank you for the recommendation, Sam. Now that we have Ms. Davis's full medication history and a cause for her GI bleed, she'll be able to go home in a couple days.
Great. Should we go ahead and discuss the plan with Miss Davis?
Good morning, Ms. Davis.
Good morning, Doctor. Good morning.
What's going on today?
Not much.
Okay. Well, we came up with your plan. We've gone over it with you and the follow-up before you're going to be eventually discharged. So wanted to see if you had any questions or any concerns about the plan that we've developed.
As long as I can go home, I'm good.
You should be able to go home in a couple days.
Okay, thank you.
If you have any concerns during the day, just let the nurse know, and she can let the pharmacy student or myself know.
Okay.
Okay?
Alrighty. Thank you.
Thank you.
Hey, Sam, how did rounds go? Did Dr. Scott agree with your assessment?
Yes, he did. And we spoke with Ms. Davis on the risk of drug interactions associated with warfarin therapy. And we're monitoring her INR daily, as you can see, until her level is therapeutic. And we also had a follow-up appointment scheduled with her PCP in the next weeks.
Oh, that is great. And good job working with the team and also including Ms. Davis in her own patient care. That's awesome.
Thank you.
Mm-hmm.
The key points for pharmacists to keep in mind about the PPCP are that it is, number one, patient-centered, meaning the patient needs to be engaged and involved in their care. Number two, a collaborative care model where pharmacists work with and communicate with other healthcare providers so that care is coordinated for the patient. Number three, documented. The pharmacist's care plan must be properly documented and able to be accessed by other members of the healthcare team. As you have seen, 5 simple steps can greatly impact the life of a patient. When working with pharmacy students, please remember to model for them the PPCP: collect, assess, plan, implement, and follow up, because ultimately, it's all about patient care.